To talk about something I think that was one of the biggest stories yesterday as well, Erin. It is about the HIV/AIDS survey, the latest one, showing that about 60% of South Africans living with HIV are taking anti-retrovirals.
Yeah, that's according to that latest National HIV Prevalence, Incidence and Behavioural survey.
Well, it does show there's been a decline in new infections compared to 6 years ago. Erin Bates here to tell us. She attended the briefing there. Erin, just looking at the figures, looking at the overall findings, as South Africans, are we getting better at taking care of ourselves or not really?
We're getting better in some areas. So, for example, on HIV testing, condomization, we're doing quite poorly. HIV testing, circumcisions, and also ARV treatment, we're doing quite well. But this is compared to the last study in this series. So there have been 5 of them, and they're looking at their own data between their different sort of periods. So in that sense, on those 3 fronts, we're doing quite well. Certainly, there's a lot of other work that needs to be done. And if you really drill down the data per subject area and age group, it starts to vary and we see quite a different picture. Men, for example, are far less likely to know their HIV status than women.
What about risky behavior?
Yeah.
I mean, you've mentioned the question of condom use. Is it getting better? Is it higher? Is it low? What did the survey found, especially among young people?
Well, the big concern among young people is that young men are starting to show higher HIV prevalence compared to their female peers, and also that young women have higher rates than men. They're sort of catching up with one another, but that young women are much higher than their male counterparts. And that, we were told during the briefing yesterday, was due to this phenomenon of women having relationships with much older men. So interesting there, the focus being on the younger women. In fact, in that case, obviously, they're not getting HIV/AIDS from the sky. They're engaging in relationships with much older men who may have multiple partners, have more sexual experience, and are then transmitting the virus onto them. So there's certainly a lot of work that needs to be done on that front.
Well, just looking at the new number of HIV infections, the incidence significantly declining in 2017 compared, like you say, to findings of a similar survey conducted in 2012. What do they attribute that to? Did they give reasons for that?
They didn't, and what's so challenging at this point is we don't have the final report. These are a summary of the data that they have, and they're going to release the full report during the International AIDS Conference next week in the Netherlands. So we're getting sort of some information that's helpful, some information that's qualified on the issue of prevalence. Yes, compared to the 2012 study, HIV prevalence has gone down, but later in the same press release, they say there is still a concern about HIV transmission and new cases of HIV being identified.
Okay, now prevalence and ARV usage, is that correlated? Are there more people now on ARVs than ever before?
Well, what is interesting there is that more people are living with HIV/AIDS. So the minister, for example, and Dr. Zuma from the HSRC both saying if you test, you know your status and you're responsible with that information, it has a very positive and powerful impact on these statistics. So people who take their ARVs, take them responsibly, and have a sort of undetected viral load are contributing to dealing and tackling with HIV.
I mean, asking that, I'm not a statistician, Erin, I know you're not either, but I was thinking they said about 4.4 million people who live with HIV are on ARV treatment, but the total population of people living with HIV rather in 2017 was 7.9 million. That's just like half.
Yeah.
So is it correct to interpret that half of people who are living with HIV are not on ARVs, or am I wrong?
I don't know. I don't want to veer into that kind of analysis because I haven't seen the full report and I don't want to misrepresent the data from the HSRC. I can say more generally, not being a statistician, as you've rightly pointed out, or an HIV/AIDS expert, that some of the main themes coming out of the event and out of the briefing with the minister afterwards is that people need to be responsible, they need to know their status, and that they're very concerned about the rise in young men's HIV statistics.
Now, talk about knowing your status. Is there a demographic differentiation? Do young men know more about their status than women, or vice versa, or are people really going out generally finding out about their status?
Generally speaking, men are far less likely to know their HIV status than women. The minister cited, for example, a separate government survey where 65% of the participants were women and came forward and got their HIV status, 5% were children, and 30% were men. It's a very low number. Also concern over the fact that there were 33,000, beg your pardon, participants in the survey, and initially they had a lot of resistance from people people on providing blood samples. So in May of last year, the HSRC issued a statement calling on the public to say, this is an anonymous survey, it contributes to public knowledge about HIV/AIDS, please provide your blood samples. And interesting too that one of the field researchers I spoke to said in the Northern Cape, but also nationally, she was based in the Northern Cape, there was a lot of reluctance from white South Africans on giving blood samples and actually just participating in the survey, and they had to get radio advertisements in Afrikaans in that area in order to encourage people to come forward, at which point they did.
Very interesting info that, but you speak of the Northern Cape. Very quick breakdown for us, the provinces with the highest prevalence, if you can just...
Yes, I'm going to have to refer to my notes there, I don't know this off by heart, but certainly within the age group, and again it's important to distinguish because they do bracket things according to age, between 15 and 24, the most worrying provinces in terms of HIV transmissions and cases were KwaZulu-Natal, the Free State and the Eastern Cape. The lowest in the same age category, which is 15 to 24, were Limpopo, the Northern Cape and the Western Cape, but noting there that the Eastern Cape and Western Cape generally have had fairly low HIV transmission sort of numbers for that age group, but they have increased since the last survey.
And no mention
of
Gauteng.
Not from the summary, and we don't have the
that's
final
good or
report.
bad news. Okay,
No.
let's see if it's good or bad. Thanks very much, Erin Bates, breaking that down for us, the latest HIV/AIDS research or survey findings.